We really, really need each other right now. So this is not the time to be siloed. This is the time to reach out to our colleagues out there and join forces together.
Welcome to the Nonprofit Fundraising Exchange, a podcast from IPM Advancement. We believe strong nonprofits can change the world, and our goal with each episode is to bring you insightful conversations with thought leaders from the nonprofit sector. Let's get started.
Welcome, listeners, to another episode of the Nonprofit Fundraising Exchange. I'm your host, Rich Frazier. Today, we are beginning a multi-part series on the uncertainty nonprofits are facing in terms of federal funding. Now, to understand where we are, we first need to take a step back and look at how we got here. In just a few days, a series of rapid-fire decisions at the federal level sent shockwaves through the nonprofit sector, leaving a lot of organizations uncertain about their future. Here's a quick recap of what happened. On January 27th, the Office of Management and Budget issued a memo freezing federal funding based on an executive order from President Trump. On January 28th, a federal judge blocked that freeze from taking effect. On January 29th, the Trump administration officially withdrew the memo. However, even with the memo gone, there's still chaos. There are lawsuits. Some state attorneys general are suing over the freeze, arguing that it harmed nonprofits and other recipients of federal funds. Some federal agencies are still holding back money, even though the memo was rescinded, so there are funding delays. The rules are unclear. Earlier executive orders related to funding are still in place, and agencies aren't sure how to interpret them. The Department of Justice says the lawsuits don't matter anymore because the memo is gone. Meanwhile, the White House insists that it didn't rescind the funding freeze itself, just the OMB memo, leaving many wondering what's actually happening. So this uncertainty is leaving nonprofits, government agencies, lawmakers, and the rest of us trying to figure out what rules actually apply and whether funding from the feds will flow as expected. Nonprofits are scrambling. Some are in full panic. How do they continue to serve their communities when there's a chance that funding could be cut off with little or no notice? Our goal today is to help untangle the key challenges that nonprofits are facing in this environment of uncertainty and provide suggestions for a path forward. First, let's meet our panel. I am joined today by Elizabeth Silverstein, nonprofit consultant with IPM Advancement, Silverstein Funding Solutions, and Vision Connect Nonprofit Consulting. Beth, you're no stranger to the show. Welcome back.
Thank you.
Also joining us today is Dr. Ann Newland, the CEO of North Country Healthcare, a federally qualified healthcare center located in Flagstaff, Arizona. And you've also been on this show before. Welcome back. I wish the circumstances were more pleasant.
Thanks, Rich. Me too.
And first timer on the show, Lauren Steiner, the founder and CEO of Grants Plus. Lauren, it's a pleasure to have you today.
Thank you, Rich. So happy to be here.
Now, before we start discussing potential challenges and strategies, Ann, I want to start with you. I want to ask what it was like for you and the North Country Healthcare team when all of this came down. Tell us how things unfolded for your team and what the impact has been at North Country.
Well, it was super stressful, Rich. So the order came down late on a Monday, and it was during payroll week. So typically, we do draws on our federal grants. We initiate them on a Tuesday so that we've got them in the bank for Wednesday and roll out and process payroll. Because we do draws basically every 2 weeks to help support the salaries. And just for context, North Country's budget is just north of 60 million. And we have over $18 million of federal grants. A portion of that is our core federal 330 grant. That's part of what makes us a federally qualified health center. And that's just under $7 million. So like a little over 10% of our overall revenue. The other grants programs support specific outreach efforts like the CMS Navigator Grant to help people sign up for insurance, either on the exchange or through Medicaid. We also have a Department of Justice grant that helps with our sexual assault work, where we do forensic nursing exams and things. So there's the core work and then all the other programs that get supported. So that meant we couldn't do draws on our core grant during payroll week. And what we were told was that the delays in the system, once the memo got rescinded, were related to the volume of requests that came in after that executive order came down. And fortunately, the following week, we were able to draw down funds from our core federal 330 grant. But it was pretty bumpy. In the past year, we've had some real financial challenges. So being able to bridge payroll took some deep breaths and juggling. And it's not ideal to work under those circumstances when you're worrying about paying your staff to continue the mission.
Right. Yeah. And we're going to come back to that staffing question. But, talking about juggling, I mean, this whole thing is forcing a lot of nonprofits to rethink their financial strategies. So I'm just going to start with this question. Beth, where do we start? Where do nonprofits start?
Well, I think that all of us on this panel can speak to this in so many different ways and with so many different hats. As a not-for-profit consultant, I'm also on the board of a not-for-profit that was deeply impacted by this. So much of my take on what has happened is really straightforward. We have to know exactly what the impact of this funding crisis is to us. And so, the first takeaway for me was, as we are telling all of our not-for-profits to do their impact statements on how their philanthropic funds are impacting their mission, well, now we have to do an impact report on how each grant and the loss of that funding is going to impact our operations and our mission, so that then we have the information in place to take to our boards and to really sit down and start to talk strategy. We've been talking for years, Rich, you and I, about how important it is for not-for-profits to diversify their funding model, but we always thought that government grants was the best way to diversify your funding model. I mean, that is how our social services really are paid for and delivered in the United States. And it's been a tremendous partnership between our not-for-profit sector and our public sector. It has been a fabulous partnership. But now all of a sudden that's changing. So now we really just need to understand what that means for each one of us.
So, Lauren, as we start understanding what it means for each of us and we start aligning our strategies around the board table, the executive conference room, and with our stakeholders, what are some of the strategic questions we need to be asking ourselves?
Well, I love, the idea of contingency planning. And I love what Beth was sharing about each grant. What's the potential impact? And what do we do if this one goes away completely? Is this a closure of a program? Is this a reduction in services? Does it mean we'll look for external funding some other place? I mean, I think it's important to know that this is going to have reverberating impact on the entire sector, even if they're not like Anne's organization and heavily dependent on federal grants, because there will be more pressure on private foundations to give.
Right.
So, yeah, as I think private foundations gave like $100 billion to the government's $300 billion in federal grants in a year. So we can't make up the difference. I guess that's the point in private grants. So likely competition will increase. And so we need to be standing out. I have so many ideas and guidance for nonprofit organizations on how to do that. But I think another important point would be don't panic, right? It's absolutely right to be concerned. It's not helpful really to panic right now. It's concern and then action. What is the next action we need to take?
And I'm going to come back to you because as you're trying to figure out how do we pay our staff and how do we run our programs, what kind of scenario planning did you and your team go through in those early days?
So we know that the loss of some grants will cause us to shutter some programs. That's just the reality. And how do you do that in the most thoughtful, responsible way possible? So, we've drafted templates of letters for staff when we get the confirmation that certain grants will be going away. We are also in the process of pursuing a bond placement. So that will help us increase our days cash on hand and have us give us a little more long-term stability. And that was in play before the dramatic actions of the end of January. Mm-hmm. And part of that also is looking at ways for us to invest. We're as a primary care and dental facility, we generate revenue. So we have to look at other ways that we can generate revenue. We're looking at putting in an in-house pharmacy in our Sholo location, for example. So making sure that we've got the capital to do that and knowing that that will lead to revenue generation. But none of these are quick fixes, right? You can't pivot from having 18 million in grants out of a $60+ million budget to dialing that down to only 10% of your budget over the course of a year. And I would like to underscore that the federal investment in nonprofits and all these programs is essential to the functioning of the healthcare safety net, to the arts network, so many important agencies. There needs to be a thoughtful examination of what's affected. And I think when people realize what the impacts are, it'll be harder to move forward.
Well, that sounds like a great topic for an additional episode. I want to stay with you, Anne, for a moment, because when you're talking about potentially shuttering programs, that can impact a lot of jobs. How do you provide some comfort for your staff? How do you treat staff with compassion and dignity?
Yeah. Well, one, that's part of our core values. We can't carry out the mission without the folks who work at North Country. And one of the things that I love about working at North Country is that the staff are so engaged with carrying out our mission. That's the broader mission, and then the individual efforts of their particular programs, whether that's for early childhood intervention, supporting women through their pregnancies, dental care, the whole gamut. So I think being transparent is super important. As we know things are changing, share what we know with staff and try to reduce their fear. Because what are people most afraid of? They're afraid of losing their jobs. And sometimes you have to say the hard truth that, yeah, your job is going to be impacted. And while your job is impacted, we want you to be at the front of the line for positions within North Country. As big as we are, there's often other opportunities. It might not be that first thing that somebody wants to do, but it's something for them to look at. And our HR department has been really intentional about developing some resources to help people transition into another position outside of North Country if something happens. Last year, we went through a reduction in force because of some financial challenges that happened in March. And it's nothing I would ever want to go through, but the materials we developed then and the approach we developed then to talk to every person affected individually, make sure they had a written letter of recommendation for their positions and some resources through our EAP program and other things to help them with that transition. It just helps us now.
Can I play off of that for 1 second about communication? So I totally applaud, the transparency as much as is appropriate with your staff. I think that's just an amazing part of your culture. And I also always encourage our clients to have that transparency with their private funders as well, with all of their funders. But I think sometimes there's this power dynamic between funders and grantees. We always want to be doing the right thing by our funders. And I think sometimes that causes fear for us to be completely honest about where we are or the situations that we're facing. I think this is probably rather obvious to funders, but don't assume assume that your funders know what you're facing right now if you are not telling them. And the other thing is someone is telling them. So if you're, you can not act and it could be at your peril because, someone else is going to get first in line. So, being close with your funders and being honest with your funders and your board so that they can be your advocate about really what is going on, what's at risk, and that sort of thing.
Let's stay on the topic of funders, Lauren. Mm-hmm. Are funders responding or are they going dark right now?
Yeah, it's interesting, Rich. I feel like it's about 50-50, right? I think some of them don't know exactly what to say yet. And so they're not saying much. So it is a little frustrating, but we have to be patient and understanding that they're going through their own process. But then there are others who are really taking a stand. The director of the Denver Foundation recently came out about DEI and said, it's under fire. It's under extreme fire by this administration. And he said, we're doubling down. He said, we're not backing down on this. And I think that is certainly a choice, but that's to say, like, it's the same tenet that has existed forever, which is if you know one funder, you know one funder.
Yeah.
So you can't assume that they're all in one camp or the other if you're not talking to them and definitely looking at whatever they're putting out. Now, I think now that the dust has settled a bit, more funders are coming out with, what they're intending to do. I've seen some relief funds. I've seen some relaxing of restriction on funding, which is beautiful. The private sector does step up in times of crisis. Now, what step up, to what level, we're not sure yet. So I would just say it's a mixed bag, but we don't know unless we ask.
Hi, this is Curtis Schmidt, producer of the Nonprofit Fundraising Exchange. If you're a nonprofit professional who has questions about your program, or maybe you feel like you've taken your advocacy, fundraising, or membership effort as far as you can and you need some fresh ideas, then we have a special offer for you today. NPFX podcast listeners can get a free 30-minute consultation with IPM Advancement, no strings attached, when you go to ipmadvancement.com/free. Just enter a few details and an IPM team member will contact you to follow up. It's that easy. That website again is ipmadvancement.com/free. Thanks for listening, and we hope to talk to you soon. Now let's return to the episode.
You mentioned earlier that the private foundations are never going to make up what we're lacking from federal funding. How do nonprofits position themselves to be more competitive? And I'm going to throw that to both Lauren and Beth.
I do have some thoughts because, of course, the concern is as everyone loses their funding at exactly the same time, there's going to be a frenzy of competition amongst these funders. And so, I can see it from the funder side of, oh my goodness, now what are we going to do? So I do really think that this is the time more than ever before for organizations to join forces, to really start those conversations with each other. They all know who has this funding. They all know who's getting funded from the same foundations they're getting funded from. It, to me, would make a tremendous amount of sense for them to join together, have those conversations, do some impact mapping and some planning together. And perhaps as a team, come back to those funders and sit down and just have those conversations. If this promotes siloing instead of coalition building, then we've gone exactly the wrong way.
I agree with that.
100%. I agree as well. And I've seen it too around some chambers. We have some human service chambers in Ohio, and they're getting together to look at what the potential impact could be, and so that they can go to their funders together. And I think that's really a great move. Also, I think, in the face of increased competition, how do you stand out? I think you build upon relationships. People want to believe that grant seeking is transactional. It's not. It is a relationship-based activity, just like any kind of fundraising is. And so building upon those relationships. And then also, I think a lot of people use boilerplates in grant writing. But I would not advise you to be submitting the same boilerplate language that you were submitting this past summer, because things have changed quite a bit in the world and in the environment. So you always want to make sure that you're speaking to that funder, number one, about what that funder cares about and how you're going to help them further their mission, but two, within the context that we are all in. And so I think you've got to make sure it would be tone deaf to submit an application that is all about what your organization is doing and not what's going on in the community. It's got to be integrated in that.
I want to go back to something Beth said about joining forces and not siloing. What are some other ways that nonprofits can collaborate with each other and help weather some of the challenges they're facing right now? And I'm going to start with you. I know you're already working with some other organizations. Can you give us some examples of what you're doing?
Yeah, I'll highlight one example that comes to mind. It's our NACASA program, Northern Arizona Care and Services After Assault. So North Country does forensic nursing exams for people who've been assaulted. But the program is a collaboration with a number of other groups in the region, not just in Flagstaff, but in Apache County and Navajo County. So we work with the county health departments, we work with local hospitals, we work with victim witness, and we're also dependent on Department of Justice grants. So when that grant is threatened, the coalition can't collapse. We have to find ways to co-advocate for additional funding, for sharing resources, because this is an essential service. And the model we've used in Northern Arizona just reflects the needs of a rural community. What you can do in a big metropolitan area like Phoenix doesn't necessarily fly in the smaller communities of the North. We have to hang together and find other sources of funding, ways to be more nimble. That's just one example that comes to mind.
That's a brilliant example. Lauren, are you seeing similar examples like that?
Yeah, I mean, I'm thinking of the Council on Nonprofits and some other organizations that are doing some advocacy efforts, and how much stronger it would be if all, many organizations in a community were all approaching their legislators with similar language, or doing these advocacy efforts together. How much stronger that could be than a single organization together. And I am seeing some of that.
Beth?
That's exactly right, Lauren. We are definitely better together. And, when it comes down to actually the business model, a lot of these direct delivery support organizations, there can be numerous organizations, we'll pick a cause, addressing maybe the homelessness crisis or affordable housing, or two areas that I work in. Multiple agencies are addressing this issue. I do think that there is some tightening that can happen if we were all to come together and really identify everybody's superpowers. So somebody their superpower may be street outreach. Another one may be childhood and kid education, or, there's all the different pieces that go into supporting these communities. And if these organizations could come together and maybe create a business model that was a little smarter, so we didn't duplicate as much service, maybe you could be a little leaner. I do think that there's a lot of opportunity for maybe stronger strategic partnerships, not just loose collaborations, but really sharing programs.
And nobody collaborates and partners like nonprofits do. I said it out loud. I'm going to shift our conversation to the communication with the individual donors. There's been a lot written about avoiding desperation fundraising. How do we avoid that? How do nonprofits message about the potential crisis without sounding desperate? What should they do? What shouldn't they do? What should they say? What shouldn't they say? Let's start with you, Lauren.
Okay. Well, I think it's a fine line, right? Like I really do. And it's a balance that you need to strike. And the interesting thing too, that, I called it perfect storm of like all these things happening at one time. Individual donors are down. This potential foundations are narrowing their focus, right? And then what about the potential of individual programs like government supported programs reducing for individuals? Like, this is just creating a perfect storm. Mm-hmm. So I think the way we can communicate with our individual donors is as real as possible, and use this as a moment to build some trust with your donors. Not the alarmist kind of communication, not the we're totally fine, don't worry about us, but some striking the balance where you can be as transparent as possible and as real as possible with them, and inviting them in. That's the other thing. We come from a barn raising tradition in this country. People want to help, they just don't know how. And as individual donors, we are inviting them in to help in the community which they love. So it's actually you're doing them a favor because you're providing them a way to help. So if we can look at it that way, being honest with them and then providing them an opportunity to do something they actually really want to do but don't know how,
right?
I think you can't lose.
Yeah. Beth, add-ons?
Yes. So I think this is the time for us to know our donors. We need to go deep into our data. We need to first identify those donors who have been giving to us the longest and strongest. I mean, I bet you if you go into your donor base, there are some donors who've been giving to you for 10 years. This is the time to call them on the phone and say thank you. Thank you for being with us for all these years. We are so grateful. Things are happening right now. We just want to let you know we are strong. We are committed. We'd like to hear your thoughts about what's going on right now. And we just want to tell you that we need you to stick with us. And we've actually been doing some of those phone calls with one of my clients, and I am telling you, they are resonating.
That's great.
And then we are also asking them to be thinking on our behalf. As they, typically we all associate with like-minded people. So we want them to be our advocates. We've already told them that we want them, if they're willing to be participating in advocacy efforts as we start to build those, we want them to please introduce us to other of their friends who really might resonate with this cause. So get on the phone, get on Zoom, divvy all your list up to every board member, every development committee member, get your messaging together and ask them what they want to hear from you. I think that that's also the most important thing. Just ask them what they need to hear from us.
And I know that North Country Healthcare, most of your budget does not come from donors, but you do have some longtime, very loyal donors. What kind of conversations have you been having?
I haven't. I mean, that's the short answer, but that's not quite true. So for example, I'm having lunch Thursday with one of our major donors, and it's one of our usual state of the state conversations, but I've been taking notes from what Lauren and Beth have been saying, because I'm like, yeah, I need to get on that. I've been spending so much time putting out fires that I haven't thought about the communication piece. And really, to Beth and Lauren's point, this is an opportunity. It's an opportunity to invite people in and let them know what's going on, just like we did during COVID. I made a lot of those calls during COVID, and this is just COVID too.
That's right.
So this is a kind of a wake-up call for a lot of organizations that are heavily dependent on government funding. FQHCs aside, because that's how we do business there, right? But other organizations who are now sort of looking at shifting around their financial models, what should those organizations be doing now? What are the conversations, and forget the conversations. What are the strategies? What are the real-time strategies right now?
I think that one of the most important things, and Anna's doing it, is shoring up your core support now.
Mm-hmm.
And so I always look at fundraising like ripples in a pond. People always want to reach way outside of their pond and pull in these magical dollars that are going to come from somewhere. And I sort of think sometimes it's like they don't want to risk personal rejection. So it's like if you ask behind a screen, it's so much easier if $50,000 or $500,000 comes falling down from the sky. And I always tell people, like, well, once in a while that happens, right? Like, you can also go to a convenience store and get a lottery ticket and win the lottery. That happens too. But like, the real way is relationships. And so when I say ripples in a pond, it's about who are your closest funders. So Anne has this core donor, and then talking to them about who else should I be talking to? This is so important to you, and it's so important to me. And we are changing the world in this way. And who else should I be talking to? One of the most important things that a donor can do is bring in other people to an organization. Their dollars are important. Their network is that much more important because of that network and that network and that network, the multiplier effect of it all.
Beth.
That is exactly right. I'm just sitting here nodding my head. Yes, yes,
Mm-hmm.
yes, and yes. You know what? That is kind of everybody's first thing is, one, let's have an event, and two, let's find the big donor. But the big donor, you got to start so close. I tell all my clients, bring it in, bring it in, bring it in. This is about getting smaller, closer. This is about building these relationships. You have to really know your people. It is so important, and especially now. And, Anne, with your major donors, we didn't talk about that a ton, but I feel that is a piece of this conversation that's critical. We talked about that grassroots support and working with our annual donors and those people who've been giving to you a long time. But those major donors who could make significant investment, they're part of the solution. And we really need to engage them in the planning, especially if someone has truly invested in your organization in a significant way. They see this in that way. They see this as an investment. So it really is important for us to single out those donors, sit down with them, and talk to them about our strategies, and ask them, do they have ideas too? We'd like to hear what their thoughts are about the strategies that we're deploying. Are there other strategies that we should be thinking about? And who do they know?
I think that's a really good point, Beth, because as I think about this lunch I'm having tomorrow, that's not work. I mean, it's work, but it is idea generation. I am energized after the conversations I have with this donor because she believes so strongly in the work we're doing and has been so supportive to me personally and to my team over the years. Like, I need to lean in to her and the other folks like her. It makes a big difference.
Before we wrap up, I want to revisit the topic of advocacy. We'd like to do a full episode on advocacy, but I would be remiss if I didn't ask this panel for your thoughts. For some nonprofits, the loss of federal funding is going to mean shutting down programs. Anne's already talked about that today. If the majority of your budget is coming from federal contracts and diversifying funding is not a realistic option, even in the long term, we're going to have to lean into advocacy. So what exactly should nonprofits be doing when it comes to advocacy?
Okay. I think two things. One, I think they should be, like Beth was saying, joining up with other nonprofit organizations so that they can advocate together, either through an official association, an official collaboration, or an unofficial association. They should be talking with their legislators about the impacts of this so that they understand the real consequences of what is at stake. And then the second thing is engaging their supporters in doing whatever advocacy they can do. And that's usually contacting their legislators about what the impact is and what it means to them as individual voters.
Anne?
So advocacy is part of my DNA, working for a federally qualified health center.
Yeah.
We're already part of a statewide network, a national network, which helps us have resources. But for us, a lot of it's about telling the story. So the first story I try to push is the importance of Medicaid. And that's a story that I have to tell to legislators. So, for example, Representative Eli Crane, who serves the district that I live in, 270,000 of his constituents are on Medicaid. That's about a third of the constituents in that congressional district. So for our board and people who want to be engaged, sometimes they just need the language and to know the mechanics of how to contact a legislator and what story to tell that makes an impact. And I can help them with that.
Excellent. I know you can do that very well. Beth.
So let's also not forget that kind of grant funding kind of rolls downhill, remember? So, it comes from the federal government down through the states and into the cities. And so as you're putting together your impact report by grant, by where it comes from, it is very important for those, EDs and presidents and board members to start sitting with their local representatives, because at the end of the day, it's the city that gets impacted. When 300 families are kicked out of temporary shelter and they're back on the streets, who gets impacted?
Yeah.
So when you're putting that impact report together about the impact of your grant, it's not just about your loss of funding. It's about the impact on the city that is going to absorb whatever it is they're going to absorb. So it's emergency rooms, it's police, name it, it's food, it's everything. So, let's not forget about that ED sitting down with that state rep and taking care of business.
And the mayor and the city council. Brilliant
point. Mayor and city council.
Lauren.
I just want to add one more thing, and that is I just heard Phil Buchanan from Center for Effective Philanthropy address this, and that is that the nonprofit sector is bipartisan. People on both sides of the aisle care about these nonprofits. They serve on boards. This is not, it can feel like a partisan issue because we have a Republican administration who is putting forth these potential cuts. But ultimately it is not. So I think we can't be afraid to tell the real story, no matter who we're talking to.
Brilliant. I hate to bring this conversation to an end, but we are coming up on time. Before we go, though, I want to ask each of you in a round robin format, what's the one thing that you want listeners to take away from this conversation? It can be something that we've talked about or something that we haven't brought up yet. So, Anne, I'm going to start with you this time.
So I'm going to do a throwback to the 80s because I know you're an 80s kind of guy, Rich.
Yes, ma'am.
Silence equals death. And if we care about these programs and we care about the communities we serve, we must speak up. Visibility matters.
Beth.
The most important takeaway is that we need each other. We really, really need each other right now. And so this is not the time to be siloed. This is the time to reach out to our colleagues out there and join forces together.
And Lauren.
Yeah, I think this just piggybacks on what both ladies have said, but this is not the time to be reactive. This is the time to be proactive. So pick up the phone and call. We can't afford to sit back and wait and see what happens.
Be proactive, be loud, and join with others. Thank you. Lauren, Anne, and Beth, thank you so much for joining me today on this episode. One last thing, where can listeners find out more about you and your agencies? Anne?
NorthCountryHealthcare.org.
Lauren?
GrantsPlus.com.
Beth?
VisionConnectLLC.com.
Thank you so much. It's been a terrific conversation. One of my favorite episodes. I want to thank you all again for being guests on the program. Thanks to our producer, as always, Curtis Schmidt. And a reminder to our listeners, this is a big conversation and we're not done with it yet. So please stay tuned for future episodes where we hope to explore the roles of advocacy and action, lessons learned from COVID, and using consultants and outside experts to help navigate through the uncertainty. Listeners, thank you again for tuning in. We'll see you next time on the Nonprofit Fundraising Exchange.
That concludes this episode of the Nonprofit Fundraising Exchange. Thanks to our panel for sharing their insights and expertise. If you'd like to learn more about our panel members or any of the organizations or resources featured in this episode, we will include links in the show notes. If you like this podcast, we would love your help spreading the word. First, please subscribe in Apple Podcasts, Spotify, or your favorite podcast app so you always know when a new episode is released. Second, forward the episodes you like to friends and colleagues or share them on social media. Word of mouth is one of the best ways you can help us reach more nonprofit professionals like yourself. And if you use Apple Podcasts or Audible, please leave us a review. Positive reviews are how many listeners decide whether or not to try out a new podcast. We appreciate your help. For suggestions on topics, guests, or nonprofit organizations you'd like to hear on the podcast, send an email with the subject heading NPFX suggestion to contact@ipmadvancement.com. For back episodes and more resources like white papers, infographics, and blog articles, please visit the free IPM Advancement Nonprofit Resource Library at ipmadvancement.com/resources. Thanks for listening, and we'll see you next time.